My name is Chitra Puranik Kuve. I'm the General Manager for Training in Cloud9 chain of hospitals. So the quality of care in any hospital these days is increasingly there's a demand for a better and better quality of care. And the definition of the quality of care is going through a change. 10 years ago, 15 years ago, quality in a hospital or in any kind of clinical care would always mean treatment, would always mean what the doctor can do for you, how quickly the doctor can look at you, treat you, etc. But now, in 15 years, with the amount of corporate hospitals we have, the focus is much, much beyond just treatment. People want wellness, people want to be taken care of, assured, outcomes not just in terms of how quickly and how good we are treated, but how well we are treated. So quality itself, the definition has gone beyond what we used to have earlier. Even in terms of clinical quality care, we are looking at much, much different parameters than earlier. Now we are looking at how minimal use of antibiotics we can make through surgeries, which was not there earlier, which was we would need antibiotics was a given earlier. But now, how less antibiotics can we take during the surgeries? So I think these parameters are very different from what it used to be earlier. Earlier, we used to be able to hear these parameters in the West. Now, right here in India, we need these parameters. So I think quality of care, the definition itself is going through a lot of change in the last 15 years. More and more want customer service. Patients want customer service. In a chain of hospitals like Cloud9, where the focus is on maternity, moms want the best experience. They check into the hospital for delivery, and it's our challenge to give the best service to them. It should be an experience of lifetime. So when we say the experience of a lifetime in terms of maternity, then the quality has so many other parameters than just clinical care. And clinical care by itself cannot be at any time compromised. It has to be excellent, but that's not enough. When we say delivery of quality care, remember it's just 15 years since we started talking about customer service for patients. And none of the system is geared up for delivering it yet. Are the nurses trained in customer service in their nursing colleges? No, none of them. Is the management focused or trained in being able to look at patients and patient service? Not fully yet. We're learning that. We're learning service standards. We're learning to look at the patient as a customer and try our best in exceeding what clinical care that we can give. So the rest of the system that should support this quality of care is not yet in place. We still have very high attrition. The amount of investment that we do in the skills of people to be able to deliver this sort of a quality care. How capable are we to reassure the customer when the customer needs reassurance? Are we able to hold the hand of the customer or the patient through the difficult times? We are not yet there, and a lot of investment has to go there yet. So traditionally, 15 years ago, before corporate hospitals, the investment was predominantly on clinical care. All the skills that we needed was how excellently we can treat the illness. We are beyond illness. We are into wellness. And how do we help wellness? A lot more factors. And who invests on identifying these factors and getting the skills for these factors? Colleges, not yet there. Our educational system is not yet there. We are at the leading edge of it. So at the leading edge of it, it has to be the management of the hospitals who have to invest on this, to invest on getting the skills up of every sector of the hospital workforce. The nurses, the customer service, the guest relations, the nursing care has to be not just clinical, but it has to be able to hold the hand of the customer, of the patient. So these skills, it has to be the choice of the hospital to invest. And that choices have started. A lot of hospitals have chosen to invest on this softer side of the skills. And I think it is bearing results. It's beginning to show results. Impact is slow because we're just starting out. There's still high amount of challenges in being able to show the impact, but the march is steady and it has nowhere else to go. It has to grow in this direction. So in that sense, the impact is slowly progressing. Whichever hospitals are able to go beyond and invest on the staff and invest on the systems for delivery of the skills for the staff, we are able to make a difference. We are able to stand out in the quality of care given to customers and patients. For example, this platform, you imagine organizing a training program for staff, for nurses, is extremely difficult in the hospital industry because of the number of shifts, because at any time, if there is an emergency, then everything else gets cancelled if necessary. So training falls not on the high priority. It never falls. And getting people out among shifts for, training program typically needs about at least 10 people for a session. Getting 10 people out of a unit of about 145 staff is not easy because people are on shifts. So in such an environment, investments have to be made in several other areas. For example, creating an LMS platform wherein the training can be taken by the staff at their own convenience. Night shift, the content is there on your app, you just have to go through it. You are between very heavy patient flow zones. Afternoon times are usually pretty low footfalls. At that time, you can use the app and get all the learning. And then in the actual face-to-face learning program, training program, we meet and we build on what you've already gone through in the content of the LMS. So these sort of a very forward-thinking, creative, innovative solutions to invest on people. These are what the kind of investments that we need.